keep my mask on. My child is sick at home, so I don't want to risk any of y'all's health. But my name's Lisa, and I'm the Executive Director of the Tennessee Immigrant and Refugee Rights Coalition. Thank you so much, members of the committee. We're really grateful for this opportunity to come before you today to share our proposal to expand immigration legal services to Davidson County's immigrant and refugee residents. As you all know, Nashville and Davidson County pride itself on being a welcoming city. We're home to a diverse and vibrant immigrant and refugee community with more than 140 languages spoken in Metro public schools, and 13% of our residents identifying as foreign-born. Unfortunately, however, many of our immigrant residents are unable to access federal work permits, protections from deportation, social security numbers, driver's license, or a pathway to citizenship. Not only because Congress has failed to update our immigration laws in 3 decades, but also because of the scarcity and high cost of immigration legal services. So this barrier leads to other barriers, from inability to access critical services or public benefits, health insurance, fear, family separation, poverty, lack of economic mobility, all of which impact not just the individual, but the family nucleus and our communities as a whole. As a city, we've recognized that we're better off when everyone, regardless of immigration status, has access to opportunities that help them grow and thrive. That's why Nashville's been on the forefront of innovative programs such as the Office of New Americans, My City Academy, English classes and naturalization information in our public libraries, programs that assist our immigrant neighbors in accessing services and connecting with Metro government. Under the previous mayoral administration, Turk and Jayfon both also partnered to provide legal services to immigrant and refugee communities with support from the Metro Direct Appropriation Fund. So this isn't new, but as the immigrant population in Nashville has grown and across other cities as well, nonprofits have often stepped in to fill critical gaps and provide services to new Americans. Governments often rely on nonprofit partners to serve these vulnerable communities. For example, just the day before we were supposed to present in April last month, we had a pregnant Congolese refugee come into our office. She had a child with her and came into our new office in Antioch to ask for assistance in applying for TennCare. She was actually referred to us by the Department of Human Services because she needed assistance adjusting her refugee status to a green card status. Status, which will then make her eligible and allow her and her baby and her family to be healthy and able to grow and thrive. So funding specifically for immigration legal services is really hard to come by. That's where local governments can play a really important role, partnering with nonprofits who've built trust, connections, and credibility with communities to implement programs and expand access to pro bono immigration legal services. The ARPA funds have created the opportunity for this innovative funding model between nonprofit partners and governments, and to extend and bolster these critical services that can be a catalyst for other types of funding that support this work. So models like this for innovative partnerships and funding are often demonstrated at the grassroots level and then expanded statewide and federally. With ARP programs, we've seen dozens of cities or counties use these funds to start or expand their immigration legal services program, all which help aid in economic recovery, stability, and shared prosperity. So our proposal today seeks to expand immigration legal services specifically through legal screenings, direct representation, and our group processing workshops known as clinics, as well as community outreach about our services and education on topics that keep families safe, whether it's know your rights, naturalization information, how to avoid legal fraud, individual responsibilities in the legal process, DACA updates, and others. So thanks again for this opportunity. We look forward to your questions, and I'll just turn it over to my partner, Tessa, from the Tennessee Justice for Our Neighbors.
Thanks, Lisa. I'm also going to keep my mask on because I also have a sick child at home. As Lisa said, I'm Tessa Lemos-Del-Pino, and I'm the Executive Director at Tennessee Justice for Our Neighbors. Joining me is Bethany Jackson, our Legal Director, and we are thankful for the opportunity to come share some information with you all about our subcontract portion of this. Rather than criminal sanction. While their penalties are profound, immigrants facing removal are not afforded the constitutional protections under the Sixth Amendment. Immigrants, however, we know fare much better if an attorney is present at every stage of the immigration process. And as was mentioned in the proposal, and I'm also able to provide a report from Professor Carla McAndrews at the Vanderbilt Immigration Practice Clinic, there's a growing municipal effort to fund immigration legal services. Navigating the immigration system is complex, constantly changing, and takes considerable time. The clients we serve fall within 200% of the federal poverty guidelines and cannot otherwise afford representation. The clients we serve are survivors of serious crimes, trafficking, and domestic violence. There are children who have been abused, abandoned, or neglected by a parent and referred to us through the foster care system. There are people who were brought to the U.S. as children and have only known this country as home, yet they are unable to access the privileges many of us access without question. Tennessee Justice for Our Neighbors also represents asylum seekers. And this last case type is important because we are in a unique period of increased need for immigration legal services at this time. Most of the recent group of Afghan arrivals are here on a temporary immigration status called Humanitarian Parole. They have permission to live and work in the United States for 2 years. To remain permanently in the United States, they must apply for asylum. And while most of this group arrived in August or September of 2021, our law requires that they file their asylum application within 1 year of arrival. There has always been a need for immigration legal services, but this community is faced with an urgent need for the significant. We're also holding another continuing legal ed with one of our partner law firms later on this month in hopes of recruiting more attorneys. The resettlement agencies, who are funded by the federal government, have referred 410 Afghan evacuees to Tennessee Justice for Our Neighbors for an evaluation of their immigration options. Of those determined to be eligible for asylum in their screening, Tennessee Justice for Our Neighbors, Vanderbilt Immigration Clinic, and Pro Bono Counsel have accepted around 39 cases. We have 91 individuals or family systems in need of an attorney to file their asylum application. That's just one segment of the population we're serving. What we really need are more paid staff. As Darkenia mentioned, it is critical that we have folks who specialize in this type of work, who are consistently doing this work day in and day out. In bringing paid staff, immigration attorneys, and accredited DOJ reps, we'll be able to more appropriately address this immediate need. The urgency of the Afghan situation underscores the importance of building the legal immigration services that our community has long needed. There are only a handful of immigration legal services providers in the Nashville area, and we are the largest office. We have the most number of employed attorneys, but there are only 3 of us. And we represent an average of 500 clients per year. Tennessee Justice for Our Neighbors is essentially a not-for-profit law firm. We provide free or low-cost immigration legal services to individuals who qualify for humanitarian relief. So that's victims of domestic violence, children, like I mentioned earlier. And we educate the public about immigration matters. We've represented more than 1,500 DACA recipients and more than 3,000 clients since our founding in 2008. Other practitioners serving the same population in different jurisdictions. This is a tremendous benefit because we live in a legal services desert. And while we're proud of the work that we've accomplished, we know that the need for our services is greater than our current capacity. Last year, we measured 1,500 phone calls or emails from individuals seeking immigration information. Of those inquiries, we were only able to accept 321 new clients. That was a lot of unanswered calls. With our current staff, we anticipate that we will continue to provide ongoing legal representation to our existing 327 clients with cases before the U.S. Citizen and Immigration Services or Immigration Court, screen 250 new clients for an evaluation and possible extended representation. With additional ARP funding, we would be able to drastically expand our capacity. We could hire 2 new attorneys, employ a Department of Justice accredited representative, and a paralegal to expand our services. This would allow Tennessee Justice for Our Neighbors to screen an additional 160 clients and provide extended representation to 60 individuals. This means that over the term of the proposal, the 3-year proposal, permanent residents for 160 individuals. Of these principal clients, many will have additional derivative beneficiaries, meaning that by the end of the 3-year contract, approximately 1,120 total individuals could be served. And while these numbers provide important information, I want to share how this translates to the individuals. With immigration status, one can get a driver's license, which makes our streets safer. It means work authorization, strengthening our economy, and the ability to live a stable and productive life. Mixed status parents can raise their U.S.-born children without fear of separation or deportation. Immigrants will be able to connect with law enforcement to report crimes without
Sarah, and then Councilman Sepulveda. But I have to apologize. I have to go back. My math was wrong on our last vote, and I want to correct it on the record. So it was 5. Just for the record, I'll say it was Representative Love, Councilwoman Gamble, Vonda McDaniel, Sarah Finley, and Sean Henry were the 5 that were in the room to vote yes, and somehow I came up with 4. I apologize, but I do want to correct my math. So it was 5, Alex, if you're taking notes. 5 in favor, 0 against, 2 abstentions. So I'm, yes, right? Since I'm correcting, can we redo that, Alex? Do I have to? Sure. I'm going to repeat Councilwoman Gamble's motion that we were recommending $2,610,000 for right to counsel. That will be, and we will tell folks, we will split that between Conexión Americas and Legal Aid Society. And it was seconded by, I believe, Vonda, Sarah. And then if there are no questions, we'll do another vote. All in favor? I have 6 now. and Lisa started talking, I thought, I just did that wrong. Okay. Better to get that right. To questions, Sarah, you were up, and then I've got a little bit of a queue.
Yeah. First of all, thank you for being here and for your really effective presentations of your work. I have a couple of questions. I want to lead off just with a comment, though. It seems like today we have picked two legal areas that are two of the most daunting, where the cost of not having counsel creates the highest human and economic toll for the people involved. So interesting, they're both coming up today. But I'm curious as to sort of the relationship between the two organizations and why this is sort of a request for an amount of money with a subcontractor rather than separate requests, and if there's a history of you working together and sort of how that's going to work in terms of, I'm assuming the thought behind it is there's more efficiency and more productivity, but just would love to understand that a little bit better.
And I can take the first pass and then you can jump in. So Tess and I are both relatively new in our executive director roles, although I've been now an ED for a year and a half, but in the pandemic it feels like, it's just yesterday. But clinics to help folks apply for DACA. And since then, we've partnered together, particularly on DACA and other immigration policy changes to ensure that the community is educated and to maximize our capacity and resources. Bethany over there from JFON has done a lot of, trainings with us and Know Your Rights presentations. And so, yeah, we do have a long history of collaborating together. And then Turk has a deep history of being able to really reach immigrant communities and do mass community education and mass legal screenings. And when we thought up of this idea, we thought that it would be, really compelling to work together and to be able to demonstrate to the city that immigration legal services were worth an investment. So rather than siloing JFON's work or siloing our work, how are we painting the picture for you all together about the impact that our work is going to have together and getting people access to work permits and protections from deportation.
The only thing I'd add to that is that we've actually been in a formal partnership since around 2014, along with Conexión. Missions without having mission drift, but also still trying to take a holistic approach to the cause.
Councilman Sepulveda?
Yes. Thank you all so much for being here today and for bringing this proposal before us. I guess I just wanted to point out two things from the proposal. Well, one thing from the proposal specifically, and that is the number of cities that were named specifically as examples who have used ARP funds specifically for legal services to provide, a pathway to, citizenship, essentially. And one of them is Shelby County, which is here in Tennessee. So in a city where Tennessee is usually funded with our ARP funds. And I think it's important to note because it was such a substantial number of people. And I think it's great that this is before us today. I think it is one of those steps in the right direction, similar to what we had heard before. And hopefully this isn't where we stop as a city. I have a question about personnel. So am I correct, did I hear correct that one extra lawyer would be hired for JFON?
No, it would be 2 lawyers and either 2 paralegals or 1 paralegal and 1 DOJ accredited rep. So that would eventually be 3 people who could handle their own caseload.
And then Turk would have separate lawyers hired?
Yeah, so our additional staff would be 7. So and pay a ton of debt, and so we want to hire folks from the community and train them to be DOJ reps. 1 staff attorney, a volunteer coordinator. So part of our proposal was actually looking at expanding the capacity and working to help others become DOJ reps. So not just our paralegals, but if Conexión or NICE or another agency wants their staff to be DOJ certified, they could come to our training, and we would be building up the legal capacity across Nashville. So that's what the volunteer coordinator would do, and then a part-time data and outreach coordinator, because we want to really present you all with compelling data about the impact. And I think I'm forgetting one. Am I? Oh, the outreach coordinator, who would be doing all of the Know Your Rights presentations, spreading the word about the services, and just making sure that the information is getting out there and communities know what's available beyond our services, but also just know your rights, how to naturalize as a citizen, that DACA renewals are now online, things like that.
So I know that JFON had been working specifically with Afghan refugees for a while now. With the new staff, would it still be mainly dedicated to Afghan refugees, or would this allow you to expand a little bit more? Taken in cases, will there be one centralized location that we would send everyone to, or would it be on both sides? I know that for one, it had, for the previous proposal, it had multiple sites, but like specifically there was Hub Nashville, so I would.
So I'll just say this, the demand is way high. So I have no concerns about like being able to route people anywhere. So we do a lot of cross referrals. So people will come to us and they'll need help with their asylum case, and we'll say, oh, well, JFON's better place for that. Here's their number. Or they'll come to JFON and need something that's maybe not as complicated, and they'll refer to us. So we do a lot of cross referrals. And then Turk does have a resource line that is statewide that folks can call with any kind of question or concern, and we'll try and provide an answer or make a referral, to another organization or partner.
Great, and I think next was Councilman Gamble.
Thank you. Thank you for the work that you do, first of all, and thank you for this very comprehensive proposal. I think most of my questions have been answered. I do have one question about this funding, and unfortunately we aren't able to approve the amount that you requested, but leverage to get additional funding that may be available through federal and other programs?
That's our hope, and what we've seen even pre-pandemic was cities starting to implement public-private partnerships around immigration legal services, and so that is our hope, and we had actually been trying to get that off the ground before the pandemic with the previous administration here in Nashville, but because of the change in administration and then the pandemic, it sort of became less of a priority, so we see the ARPA funds as being an opportunity and a catalyst for that moving forward. And I listed some cities, but the number of cities who actually already provide these kinds of funds and programs is much higher, because many of them were even doing that before ARPA funds, and those funds have just allowed either cities to grow or start these similar programs. And so with Nashville being such a vibrant, diverse city, we see this as sort of the next step for us to take in order to serve our really diverse population.
Any other? Yep, Jose, let me get your mic.
Couple of comments and a question, or maybe two. Thank you for being here. Of course, I want the organizations to be able to articulate out loud what happens in 2 years, right? These funds are not permanent. Certainly these funds provide some important new resources that are not permanent. And so what happens? What are the discussions that the organizations are having about what happens beyond that? I certainly, and sadly, I'm aware the work will not go away in 2 years, right? Yeah, and so, in particular for Turk, when you're at 7 funded, if approved, you added 7 staff members. That's not an insignificant number, and so what does that do organizationally on a long-term basis? So I'm interested in hearing about that. Let me just keep going, then just maybe wrap up everything together. I guess because now we can anticipate that if there's a motion here in a minute and you get approved, you're not going to be funded at that same level for the reasons that you just heard. I guess I want to use that as the excuse to reiterate the opportunity for collaboration, all right? There's substantial amount of funding that's being approved today towards serving similar populations. Come before us today to really think strategically about the communication and the education piece of this and the outreach of this. You all know, but not everybody might. I mean, the channels are limited, right? So what I would not like to see happen is the same media channel to be contacted by two different two different programs, because we're doing outreach, one on the program we just approved and one on what you're bringing before us. So I really want to encourage everybody to sit around the table and try to really leverage these funds to the max, because the demand and the need is much, much greater than, even though these are not insignificant funds. About what does this represent of your total budget, right? And this represents for both organizations an important bump into your budgets. And so how do you, organizationally, how you absorb that, and then what happens beyond? Thank you.
Yeah, so I'll start first with, we could have proposed a lot more. The need is certainly there, and there's such a crisis. In fact, when you talk about outreach, there's honestly very little outreach we even have to do, because we have such a long wait, as you know, for clients who are looking for immigration services. We certainly will do outreach, but we don't want to build up the expectation and not be able to deliver, so we do want to manage kind of that outreach. But I lost my train of thought for a second. Collaboration, yes. So, Zulfa and I had been in touch even before about both proposals and making sure there was an overlap. And we're honestly very excited As for the sustainability and long-term impact, oh yes, I remember what I was going to say. We could have proposed a lot more and really scaled up, but we really tried to manage it and wanted to not over-deliver and really grow too fast, right? And so that is the reason why, we felt like 7 staff is what we can handle and what we can absorb. We are, as an organization in Nashville and the South, are starting to evolve in the way that we think about nonprofits and funding this work. And so our partners in Maryland, our partners in New York or California, which I know, you can't compare exactly, but Nashville is sort of on that trajectory, are recognizing the need to invest in these kinds of services. And so I do see, I think, as Councilmember Suara mentioned, my hope is that we can convince can't continue at this level beyond what is hopefully 4 years. The impact in itself will be so strong and so meaningful to folks. And then with the sort of piece of the project around building capacity, so training more DOJ reps, we're going to be able to expand the capacity of Nashville as a whole with DOJ reps in communities and other nonprofits and organizations. So it's not just growing our own capacity, but others as well.
I think the other question was just percentage of budget.
Yes. So TARC has a $2.7 million budget. So I don't know what that percentage is.
So that's good. That's helpful.
Okay. Yeah, and maybe just to the point too, this is the first time we have a state grant around COVID. So again, starting to kind of shift the mindset of Tennessee and of the South of investing government funding in these types of works and these types of communities. And so that is also why we're now at 2.7 million is that state COVID grant.
Compared to the need that's out there now, but it's also the most that the city has invested in these populations, and so it is a very important moment to really prove what you're saying, right? So I am really encouraged by both proposals because I see the leveraging aspect of both of them coming together, and this fund's doing what they're going to do. So it is, yeah, I like the way you phrase it, that it is the shifting mindset of immigrant integration into communities and the way that you articulate. So I just wanted to agree with that.
I'm going to go, Sarah's got a question, and then Councilwoman Suara will come to you.
And this is not really a question as much as a comment and a follow-on, which is, just like in the prior proposal, there was a lot of discussion about getting the data and the information needed to really leverage it for future funding down the road. It would be such a lost opportunity, both in terms of your collaboration and in terms of the sheer increase in services provided for really what are material budget increases, annual budget increases. It's so easy to get busy and not to track the success of it. So just really encourage you to come up with a plan to do that up front, especially since there are 2 different organizations working together to try to track that.
Yeah, talk to that. Yeah, and that's why we built in a data and evaluation coordinator into the program to be working with both organizations. And we plan on having, I think we agreed on monthly meetings and quarterly reports with an annual report at the end that helps tell the story of the impact of our work.
Councilwoman Sahara?
Thank you for recognizing me, even though I'm not a member of the committee. I wanted to make sure that I speak in favor of this proposal because it's one that I'm interested in and I started a conversation on as well. As some of you may know, in the last couple of months, I've actually the one that has been facilitating the meetings for all the organizations that are supporting the Afghans that are coming into Nashville, and JFund is a big part of that. And what we look at is that, and I want people to look at it, that this is good, it's humanitarian, it's support, but we should also look at it as economic. If someone gets their citizenship, they get a job, they pay taxes, they buy a house, and so it's investing in the communities at large as well. And when you have immigrants or refugees in the country, here. So I'm grateful for the proposal because it allows us to do what we need to do in time and to make sure that we the one that is here and also bring the money back economically. So I just wanted to say that. Thank you. Thank you.
Councilman Sepulveda?
Great. One question before I'm going to start making a motion. I didn't quite catch how many individuals you expect to help with this request.
Yeah.
Do you want to speak to yours?
Yeah, I can speak to mine. Sorry, let me pull it up. It's hard to hold all these numbers in your head.
Just get the mic closer.
Oh, sorry. So we hope to do approximately 600 consultations and screenings per year. How many legal filings we'll be able to do as a result of those kind of depends on the case details, right? Every immigration case is different and has different weight to it. But we hope to reach 2,500 individuals by our assistance phone line, whether it's making a referral, providing Know Your Rights information, scheduling an appointment with us, or making a referral to JFund, and having about 4 to 6 immigration legal clinics per year, covering a range of topics, whether it's naturalization or DACA renewals. Yeah.
And then for Tennessee Justice for Our Neighbors, we would screen an additional 160 clients and provide extended representation to 60 individuals. And then, so over the term, we would screen and evaluate 480 individuals, and we would provide multi-year representation to 160 individuals. On average, each of our clients has a few family derivatives, and so we anticipate that the total number of individuals served would be 1,120.
Okay, thank you. I'm gonna go ahead and make a motion if no one has questions. That we fund this request at 13% with to us, but also Council Lady Suara and the rest of her team to come back to us in 1 to 2 months when we have that second round of funding in our account.
Yeah, so using a calculator, not to make sure my math is right, it would be $1,820,585. And I guess I just want to make sure, again, for flow of funds, that this request is going through Turk and you are going to subcontract with Tennessee Justice for Neighbors? Okay, so the full, from the resolution perspective, the full resolution would be $1,820,585, which I believe is Councilwoman Sepulveda's motion. Is there a second? Got a second? Are there any other questions? Any discussion? All in favor? Thank you, Councilwoman Johnston is back. Any opposed? Abstentions? We've got one abstention. So that gives me 1, 2, 3, 4, 5, 6 in favor, 1 against. One abstention.
And can I ask to be the lead sponsor on that one?
Yes. And thank you for doing that. All right, that is it. Thank you. Oh, Councilman Gamble? Yes. Thank you. Great, thank you very much. All right. Those are tough acts to follow when I'm discussing admin expenses. But this is a necessary component of these funds. We had at one time, if you remember, back when we first received the ARP funds, talked about a 1% reserve for things like reporting, using consultants, some staffing. We do use legal. Put in a request for half of that at this point, since we have half of the funding? Yes. So half of that is $457,500. And again, so if we double that, we were right at 915, and that's 0.35% of the total award. So we were looking at maybe reserving or making sure we had 1%. We're going to need about a third of that. So that's the good news is, so we will have to come back to replenish that, but just in the spirit of the way that we've been handling things with the first payment and second payment, only asking for half of that, but asking for 87% of that will reduce that request to $398,000. So that is actually the request that we make sure we have that. We're incurring some of those expenses. We need to make sure that as we incur them, we can report them appropriately as recommended and approved. So that is my request to the committee. Okay, I think here I'm going to make it official. Thank you. Then the last item on the agenda is actually not a request. Oh, did you have a question, Sarah? Sorry.
Just a follow-up question, just to make sure. What was the amount that we appropriated for the TERP proposal? Because the number I heard.
Oh, $1,820,585.
Okay, because wasn't the proposal for 3.5?
I'm sorry. I didn't do that, and they've left. Let me explain that. So their proposal was for 3 years. When you take it for 2 years, what it is, if on the page of the budget, the first 6 months, then, because they are a calendar year, not a fiscal year, then 12 months from year 2, and then half of the FY24 gets them 24 months.
Okay, so we basically put them on an apples-to-apples 24-month basis.
24-month.
Added up the respective amounts for the two.
Thank you for asking that.
I just wanted, because it was just kind of hard to jump from one to the other.
Yes, it did not. And so that, so if you took essentially that first column, from a request is not additional funds. But if you remember back, one of the very first recommendations we made was $1 million emergency response fund, and it had essentially limited expenses that could apply to that, predominantly testing, PPE, signage, I think some of the mask enforcement. I sent this in the, let me pull up. And one of the recurring costs that has continued through the pandemic is different telework, not just laptops, but software and different licenses. And a lot of the Metro employees have come back on hybrid schedules. So even though most are spending some or all of their time in the office, we've gotten used to this technology. We do things differently. We have departments that hold orientations via video conferencing instead of everybody being in the room. And it's really, it still has come up that a lot of this equipment that we had needs to be replaced because we might not have been brand new when the pandemic started. So now we need to replace it. So telework. $1 public emergency response that was set aside. To date, we have about 100,000 in that public emergency response. So there certainly is room within those dollars that have been appropriated. I'd just like to expand the eligible use of that fund because right now the eligible use of that fund does not include this type of expenditure. Are there any questions on that? Go ahead, Sarah.
I was just going to say, I was just going to make a motion, but I don't know if there are any questions.
Rep. Love?
Just for clarity, so we are expanding the use, not expanding the dollar amount?
Correct.
Okay, thank you.
And let me just, to be precise, sorry, I didn't. I'm going to read the 5 uses that exist today. So currently it is to provide testing and vaccinations, emergency COVID sheltering for unhoused population, additional PPE,
I would like to make a motion that we not increase the amount, but expand the use of the allocated dollars to the telework and other technology-related expenditures that are needed.
Excellent. Do I have a second? Any other questions? All in favor? Any opposed? Great. We have 7 in favor, 0 against. Excellent. Okay. So as of today, we did appropriate the first round of payments that we received under the American Rescue Plan. So until we have the additional funding, we won't ask the committee to make any additional recommendations to council. But next month, what we would like to do is to start the conversation of what you may have heard in the mayor's State of Metro address. The mayor did make reference to coming to this committee for $50 million in services to the homeless and an additional $30 million in affordable housing. So somebody from the mayor's office will come and start to present not only those 2 topics, but so somebody from the mayor's office, I will not be here. I will actually be out. You'll probably still hear from Kristen Butler, may hear from Wade, just to organize the meeting, but we will have our June 15th meeting, and that will look, that's where you'll start to hear about that $80 million that was in the mayor's State of Metro request. I just know I've had a few questions on that. Other questions to start with? Councilman Gamble?
Yes, and you may have just said this, but will we also get an updated report on what the allocations we've made so far and how they correspond with the community survey?
Yes, I actually have that updated through, but it doesn't include today. So I'll just update today's and send it out to the committee.
And one more question, the Small Business Recovery Fund, do we have an update, or can we get an update in June of making sure that those contracts have been completed and the program is started, and anything else that we need to do to make sure we don't drop any balls with that?
Yes, and you may also, I'm going to talk to Director Pogue. We did receive, so we had a couple of the nonprofits that had been recommended. Following up with the few that needed to finish their paperwork, predominantly their review, and we have some of those. So that may be another resolution that's coming. It's really just a piggyback off the original 2 million. But as I was explaining, if we didn't have the nonprofit named, we still have to bring that to council for approval. So that doesn't have to come back to this committee, but we will make sure that you all know which of those nonprofits ended up coming to fruition. As well as the pathway contract. Councilwoman Johnston?
Are we expecting still the same amount of money that we received for the first round, the second round, or has that been modified in any way?
It hasn't been modified, and subsequent to that first kind of indication that there could be some reduction for additional COVID as well as Ukraine support, that tended to get backed off at the federal level in Congress. It was a more than a handful of Congress men that Congress people that were in. Any other questions? Yes, Representative Love.
For organizations that want to be able to present to us like we've done in the past, what is the process?
That was the last thing I was going to follow up with, so it's a great question. Last thing for me, you all may have more. I have received, I get emails or phone calls of, hey, can I talk to you about ARP funds? Would this kind of thing be eligible? Or, hey, I want to come sit in front of the committee. When can I get on the agenda? And so we've kind of tracked with some of our larger scope, countywide, issues that were either identified in the community survey, served more of the entire county. And so we do have some of these other ones. And what is the best way that this committee would like it? I don't want them to all just kind of stop at my email or my desk with a phone call, that this committee may want to decide what they want to see. My thought was to put together that list. Some of them are very specific, some of them are more in general. Like with childcare, we knew that. So thank you again to Councilman Gamble, who kind of did the behind the scenes. This one had been, today's conversations had been brewing from early on. Councilman Swahara knew that and said, I'll work with them and bring it together. So that's kind of how it's proceeded. But we do have several what I'll call one-off.
I think it's fair for us to see who all wants to come before us and what their ask is. I think it's also important for them to understand that when they come, they need to have a plan and a very specific ask instead of an idea, because they get the money. We want to see, some immediate, we're not here to plan your plan. But if you can vet those things first, that from a, is this even eligible perspective? Because there's a lot of people that are like, oh, ARP funds, let's just throw, well, it still has to fit within the guidelines that are broad, but still specific. So if you could weed out, I think, anyway, just talk amongst ourselves and figure out how we want to prioritize who we see first, I guess, because we can't see them all. I don't even know how long is this list? Is it like 50 or is it like 10?
No, I have probably, I'd say 30, but some of them like started on day one and have, I don't want to say gone away, but some have all been here, so a good part of that list has been here. Some have been duplicates. I just keep a running list.
Yeah,
so
okay.
I think that's about right. But I'd like to categorize them.
Yeah, I agree. But just vetting them, making sure it is an approved use, and then making sure that they're prepared to come to us, because I've had a lot of people that will reach out to me that have an idea that is not fully vetted or prepared or defined. They don't have a specific ask, and I'm like, I think it's a great idea, but you got to come up with, we're a yes or no, not, yeah, let's figure it out,
right.
So that would be helpful for me, just,
excellent.
I think.
Yeah, happy to. So Representative Love, probably the more direct answer.
I tend to, we're halfway through, and I sometimes tend to think, is this a good opportunity on anything that anybody does, like halfway through anything, like stop and ponder and think, is this still the right approach? Is this still the right way of doing this? Now having, the benefit of looking in the rearview mirror, and then also looking around the country and seeing what others may have done or may be doing, this might be the right format for us to continue to do it this way, but, and I don't know, who do we put that on to sort of highlight or guide this committee through a conversation about, is this the right methodology and process for the remainder of the
say, with so many local governments and all of the different states receiving the funds, you're seeing everything. So I don't know that there's one source that could say these were the top 10 things done with ARP funds. I will ask, we are very fortunate, or I should say at least I'm very fortunate to have the GFOA, the Government Finance Officer Association. They do an excellent job helping us with, guiding through this, and that's where we get a lot of what's happening in other cities. And I'm going to ask them, the most recent report was due April 30th, it was expenditures through March 31st. The problem is so many cities have elected to report categories, that while we are still tracking by expenditure categories and making sure things that are eligible from a reporting standpoint, most cities are calling it revenue replacement. And so we're not going to be able to get the data and tracking of what the actual expenditure categories that were identified as the use, because that's not how they're being reported. which is the same thing that we've decided to do. It's a risk factor of making sure we don't get tagged by putting something in the wrong category if we are entitled to use it as revenue replacement. It's a timing, and time input. Our departments, the different need for them to detail out the reporting, not only for our team, then for submitting to Treasury. So let me see if there's a good way to find the old top 10 list and see if that's of interest.
Maybe it's not about the fund, where the money is going, but the best practice on the process. And again, this might be it, but there's other models that have emerged as
you get into the
equal
variety.
Balance. I don't.
Yeah. Okay. Do you have a question, Representative?
And in Tennessee, we had a small group. There are probably some other cities where you have maybe the entire local government elected, the legislative branch, would it be the council here, making the decisions. So I think it depends on the flow that you want to have, because sometimes a smaller group can be more nimble and can be more flexible even in its deliberations than a larger group. So it's all over the place from what I've seen. But
that's 100% accurate. I mean, council sizes are different across the country. The way the local governments are structured, it is all across the board. There's just not a pattern.
And I think there's also a rush in some instances to go ahead and spend now while Treasury's guidance is what it is now. Right, because I know for so long we were waiting under CARES to see if there would be a change for revenue replacement, and it never came. ARP led kind of with that to say, okay, do it this way, and then, well, okay, the CARES, if you got some money left, okay, you can do some stuff with that, and I think that's what has caused a lot of governments to say, while we can't.
I will not see you in June, but keep that on your June 15th, and then I will probably add the rest of the meetings through the calendar year. All right, we are adjourned. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.